So part of the process included engaging each department where we were going to have in the new hospital. So a nursing unit, a department where we provided clinical services, engaging each one of the members in each one of those departments to review their space, to look at their space and identify what works, what doesn't work based on if they could build it their own way now, how would that look? And that effort, led by Luann Brady, who's our Chief Operating Officer here for the system, and a host of others from our consulting groups, really helped design the facility on paper. But then you have to take that concept, and what we did is we took paper and created the mock-ups. We built individual rooms so that our team could walk through and see the size of the room, see where the equipment would go, where the bed would go, where the headboard would go, see how much space you have to be able to manipulate, and what would you do differently. And the mock-up was a great example, and we did that for patient rooms, we did that for operating rooms, different aspects of our new hospital design. And that really was the sweets, the magic sauce there to really help us ensure that we were designing it the right way and that it was going to meet our needs once we opened the doors. When we look at this project, we don't just look at it from the eyes of a new hospital. We recognize that we can build the best hospital that the community could ever hope for. But if we don't have the workforce to support the hospital, it becomes very challenging to meet the community needs. So part of this process includes trying to bring more workforce to our community. And that includes providers, the nurse practitioners, the PAs, the physicians who are part of our care delivery system and are necessary for us to be able to do what we do. So in order to do that, it's a challenge to recruit doctors and nurses and techs to rural communities. We believe the new hospital will help, but we also know that the School of Medicine in Baltimore, the University of Baltimore, and the leadership there really have been at the forefront of helping us define how we can bring nurses, physicians to the shore, let them experience their residency programs. Because what we found is that when they come to the shore and they spend time doing their residencies, they stay. They love the area. They want to be here. And then when you complement that with the new regional medical center, that's the home run that really will recruit those providers here. So, but it takes the School of Medicine in Baltimore, it takes the University of Baltimore and their leadership team to embrace this, and they have. And this has really become a multifaceted approach, not just a regional medical center, but an avenue for workforce as well. That's going to help us be a phenomenal organization in the future. Dave, I really see the community getting behind this project and supporting it. We have not launched a capital campaign yet. We still are in the silent phase of this campaign. And so far, with 100% board support for this project, with 100% senior leadership support for this project, and a host of other key leaders in the community who have stepped up and said, we want to be lead gifts in this process. They are not only supportive of us, but they're giving of their financial means to help support this project. So also because it's not just a Talbot County goal, it's a 5-county regional goal. And it's also a University of Maryland system campaign. So we're really relying on our partners within the system to support us in this campaign effort, and they have already in the form of contributions for our project so far.
Give Sean.
So another good example of what we're doing with this facility is geothermal. And what geothermal does is uses the constant temperature of the earth. When you get to a certain level below the earth, it's a constant temperature. And it uses that constant temperature to help cool and heat the facility. And since it's a constant temperature, it doesn't deviate or fluctuate much with that temperature. So you've got less energy needed to cool when it's hot or to heat when it's cold because of that consistent temperature coming in from the ground. So it's just another example of technology and of green ideas that benefit the community, benefit the planet, but also help us from a cost and from an efficiency perspective.